So, Dr. Mahima Thakur, please. Visual outcome of binocular implantation of Indian extended depth of focus IOL.
Good afternoon all. I am Dr. Mahima Thakur, Junior Resident, Choitram Netralaya, Indore. And today I am going to share with you wonderful visual outcomes of binocular implantation of Indian extended depth of focus intraocular lenses. The chief author of this study is Dr. Amit Porwal, Head of Glaucoma Services, Choitram Netralaya, Indore. Slides are not moving.
They will take time.
So, as we all know, cataract surgeries have revolutionized, and so have the intraocular lenses. Premium IOLs have drastically reduced the dependence of patients on spectacles. Monofocal IOLs target on only one distance, mostly distance vision, and the patient still has to wear spectacles for near vision. And multifocal IOLs have one or more focusing distances for near and intermediate vision, but then they come with associated symptoms of halos and glare. So in this study, we used supraphobe in-focus intraocular lens, which has a small central aperture, which gives increased depth of focus for near vision, and it simulates accommodation. And progressive refractive aspheric elements towards the periphery, they provide clear vision for distance and intermediate vision. The purpose of the study was to assess visual outcomes of binocular implantation of Indian extended depth of focus intraocular lenses. This study was a retrospective case series conducted between March 2023 to May 2024. It was conducted in Choitram Netralaya. 22 patients were selected, and 44 of their eyes had undergone cataract surgery with bilateral implantation of Indian EDOF lens. We included patients with visually significant bilateral cataract with less than 1 diopter corneal astigmatism, and the patient had to be willing for follow-up. We excluded the cases who had associated ocular comorbidities. Preoperatively, we measured visual acuity uncorrected and best corrected. We did slit lamp examination and dilated fundus examination. We measured IOP. IOL master 700 was used for IOL calculation. Patients underwent phacoemulsification surgery by a single surgeon under topical anesthesia, and the second eye was operated after a minimum gap of 2 weeks. Post-operatively, we measured uncorrected visual acuity at near, intermediate, and distance vision at week 1, 4, and 12, and BCVA at near, intermediate, and distance vision at week 4 and 12. So, as you can see the results here, more than 50% of the patients achieved 6/6 vision, distance vision uncorrected at the end of week 12. And more than 90% patients achieved 6/6 vision at the end of binocular vision at the end of week 12. And for intermediate and near vision, 100% of the patients achieved N6 vision at the end of week 12. So Technics Symphony IOL was first in its category, that is the EDOF lenses, but its high cost was a limiting factor. So other studies, including studies conducted with Technics Symphony and other EDOF lenses, our study showed comparable results. Concerto study was the largest multicentric study on Technics Symphony IOL, and our results were as promising and as close to theirs. Spectacle independence for distance vision was achieved in 100% of the cases in this study with a negligible residual refractive error, which is comparable to other big studies like Concerto. So I'd like to conclude that the Indian supraphobe in-focus EDOF IOL exhibited substantial levels of independence from spectacles for distance, intermediate, and near vision. And by conducting this study, we achieved perfection, independence from glasses, and we also we could also provide affordability to the patients. Thank you so much.
Any questions?
Did you expect a difference in the vision 4 weeks and 12 weeks post-op? I mean, like, what was the difference?
It should not be that significant, but yes,
Not with phaco and with these foldable and small and what
there
minimally
are
invasive.
other factors also, because in Indian setups with Indian patients, some patients are not very compliant, and some patients show up with post-op uveitis, some patients don't. So at the end of 12 weeks, at least we could achieve compliance, and when patients came to us for follow-up, we should explain them.
If the patient is coming week 1,
Okay.
he's coming week 4, he's coming week 12, that means that it's a very compliant patient, I think. Because normally if you're talking of rural population, sometimes you just don't see them after probably a week or 2 weeks.
Yeah, these
Isn't it?
patients, they showed up for follow-ups, but there are other factors also, and we could eliminate all of them at least by the end of week 12, but not week 4. So there was a difference in visual at week 4 and 12.
What is the purpose of this study?
Purpose of this study was to, we had to study how Indian EDOF lenses perform when it comes to rendering patients spectacle free, because the other EDOF lenses like Technis Symphony, they are expensive, not always available, and patients and Supraphobe in focus lens, it's cheaper than them, it's Indian, and it also rendered patients.
What was the A constant?
How much addition is there in for central Joby ED of Parton? How much extension addition for near 3.5? I have not used this lens, so that's why. And I don't think any rings are there.
No, it's an EDOF lens.
It's
No
EDOF
rings.
lenses. And addition, how much additions?
It's elongated, it has to have an elongated foci, for the thing. So
Actually, with my personal
During
experience,
biometry, any overcorrection you have given, or it is exactly ametropia reading you have taken?
No, sir, no overcorrection.
what was the A constant for this lens?
118.0.
118.0. Okay. See, what with my experience, like I have implanted quite a few EDOF lenses, and what I feel is, despite my best efforts, either I end up making the patient emetrope for distance, and the patient has to take some correction for near. Or if I plan to give a good correction for near, I have to leave the patient a little myopic.
Yeah, that's what I am asking.
Correct.
So
Vital overcorrection is
that's the
required.
basis of EDOF lenses. So
Correct.
really we cannot promise them 100% near to
100%.
nahi
It's
karenge.
the functional visual
It's
acuity
the
that we are talking about.
intermediate which we promise
But
them
6 and 6
is not possible. Though it is possible with multifocal, yes.
Not in focus, but
So,
not
Correct.
No,
It's
basically one is it's difficult to understand whether your study was on the expense of the two lenses. Was it on the contrast sensitivity of the two lenses? Was it on the visual acuity of the two lenses? I mean, what exactly was the study on? Like,
It was conducted to see if the Supraphobe in focus lens renders patients spectacle free, like independence from spectacles. That was the main focus.
so then you have to tell us about the target. What was your target for these patients? Did you keep one emetropic and the other a little myopic, or
Unless
what
you
was?
keep one
Yeah.
myope, it's not possible. Unless you keep one
Be it any
equal
lens.
myope.
I mean, like
Yeah.
we're not talking of superiority of one lens over the other, but the concept of EDOF is the focality is such that you give good distance, but for near you have to make that little change.
Ma'am, we National Eye Institute questionnaire for refractive errors, that was used to assess the quality of emetropy, I can say, in this patient. So this is the functional visual acuity that we are talking about, the comfort of the patient. We cannot say that he's reading N6 and 6.6 perfectly, but the patient is satisfied, and according to the questionnaire, the quality of refractive error, like the refractive error, it was negligible.
Okay, I want to add a point here regarding the design of your study. You were also saying that your purpose was to come up with an equally effective and economic alternative in the form of
Yeah.
Indian lenses as against the foreign lenses.
Yes.
So, but in that case, your study design should have been a comparative study design. So with one group having the, actually
Correct.
you should have a direct comparison study design for the
Our
study.
major purpose aim was to see.
Yeah, for that aim it is
and
fine.
this was the secondary benefit.
So your secondary objective will not be matched by this study.
Thank you.
Thank you.